Headlines: the CDC reporting that both whooping cough and walking pneumonia are currently on the rise. And the Academy of Pediatrics has issued a statement on injuries related to cheerleading. Joining us now to talk about all of those issues, Dr. Magna Diaz, a Yale Medicine pediatrician and chair of pediatrics at Bridgeport Hospital. Welcome to you. Thank you for stopping by this morning. The CDC reporting a rise in walking pneumonia in children. What should parents in our audience be looking for on that front?
Yeah, so we are seeing an increase in what we call walking pneumonia, which is mostly kids who don't end up needing to get hospitalized, but some of these kids do end up being hospitalized. It's an atypical bacteria called mycoplasma, which we see every year, but it's just more frequent right now. And we're seeing it also in younger kids. So usually we think of it of kids who are school age, so, your kindergartners and above. And now we're seeing it a little bit more frequently in our preschool age kids, 2 to 4-year-olds.
Doctor, you've seen an upswing in the number of whooping cough cases in children. That sounds real serious. What's the best advice for local families?
So the best advice really is to make sure that your child is vaccinated. So that's the best protection for them. Of course, some of our babies are too young to be vaccinated, so they may not be fully protected. If you have a child who's been exposed, which is happening more and more because we're seeing it more frequently, make sure that they wear a mask around other people so we're not spreading it. And if you're sick, stay at home.
Dr. Now let's talk about the risk of cheerleading-related injuries. Of course, it's not a traditional contact sport like football, but concussions are still an issue, correct?
Yeah, so an AAP statement, American Academy of Pediatrics, just came out with a statement which highlighted the fact that 1/3 of the injuries that we see in cheerleaders are actually concussions. And so it's really important, while you don't traditionally think of it as a contact sport, to know that it is a sport. And especially the ones that are doing flyers and stunts, if they have a headache or are feeling dizzy, it's really important to get them seen and diagnosed.
What can be done to make cheerleading safer? I mean, it's hard to avoid, all the tumbling and throwing bodies around on a football field for the fans.
Yeah, I think the most important thing, a lot of these injuries actually happen not in performance, but in practice. Competitions. So the most important thing in general for avoiding injuries in sports is getting a good night's sleep. If you haven't slept enough, you're actually much more likely to be injured. So getting good sleep, doing practices, having good nutrition, hydrating, those are all really important factors to keeping your kids safe when they do sports.
What about age restrictions? Is there an age when kids are too young to actually be out there cheerleading?
So under age 12, we do worry a little bit more about those kids in terms of not necessarily sideline cheerleading, but more competitive cheerleading and doing more stunts. You do need to be a little bit more careful in that age range.
All right, Dr. Diaz, appreciate the time this morning. Very informative.
Have a great day.